What is inclusive education? Inclusive education is when all students, regardless of the challenges they may have, are placed in a general education class in schools within their neighborhood to receive high quality intervention, instruction, and support that will enable them achieve success in the core curriculum. As a Nigerian teacher, I want you to know that your very classroom is an inclusive classroom, irrespective of whether you have identified children with additional needs in your class or not. Many children in early years have areas of need, some in hearing, some in speaking, some in developing their gross motor or fine motor skills, some in coordination and receiving instruction. What we need to do in all our classrooms is to accept as a school that children must be screened, must be assessed and observed before we place them in age-appropriate classes. There are times when 6-year-olds cannot receive instructions beyond the age of an average 3-year-old. It is not because the child is at fault, nor the parents not experienced. It is because the brain of the child cannot cope with instructions higher than that level. I have taught 8-year-olds that were receiving instructions for 4-year-olds. I have operated an inclusive classroom with children of different age groups, different assignments, different curriculum. I have also operated a classroom using the same curriculum for children of the same age group, but with different instructions. This is what I'm talking about. In a nursery 2 class, where the average age of my children was 4 years 9 months to maximum 6 years, I had 2 children in that class that were receiving instruction based on the curriculum of nursery 1, because they are in the age appropriate class, but their cognition and understanding cannot go beyond that of an average 3.5 to 4-year-old. Meaning in nursery 2, we were using a nursery 1 curriculum for them. I have also taught children in elementary class, primary 2, receiving instruction of nursery 2 curriculum. We place them in the age appropriate class because if they are in a lesser aged class, they will bully the younger children, self-esteem will be a factor, and parents will feel stigmatized and emotionally downcast. Before we get to this point, the first thing to do, as I've said earlier, is to assess, observe, and screen the children to agree on what curriculum we are using for these children. Before you do this, parents must be involved, the child's teacher must be involved, the school management must be involved, professional therapists must be involved for you to arrive at this. This is not a random situation of just saying, she can't cope. I think she's autistic. I suspect that she has Down syndrome. You don't suspect that children have issues. You confirm it by making use of the appropriate professionals to screen the child, to observe the child, to go through the health history of the child, and to arrive at a decision.